Alright, this video is going to be about the shoulder, the Theraband, exercise band stuff that you can use with the Thera tubing next. Okay, you can use a door anchor with this guy here too, where it goes in there, you close the door on it here, and you put the loops through here. You don't have to use one of these if you don't have one, but it prolongs the length of the band and how it'll avoid the friction and tearing of the band at all. So these are good to have the door anchors on there too. But I just got it tied to the doorknob here, just using red. Remember, the darker their cover, the heavier the resistance. You can get choked, you can go down smaller on it, get more resistant that way versus the tube that way. Okay, so the first one we're going to do is scapular retractions. And you hold here, our elbow's nice and straight, so you know the resistance. You see if it gets loose that way, it's not enough resistance on there too. So you want it to be nice and tight on there, good tension, very important. And patients get this wrong all the time, where they just come here and they're just pulling it like that. We don't want that. We want arms straight, squeeze with your shoulder blades, 1, 2, 3, and back. So the main thing is the primary move of the shoulder blades. And you can do it in succession, where you squeeze shoulder blades first, then arms, 1, 2, 3, 4, 5. So that a 5-second hold, 3 sets of 10, 3 sets of 15, work your way up. Eventually the 3 sets of 30 is the ultimate goal. Hold, 2, 3, 4, 5. So that's a scap retraction or a row. The next one we can do, we call it salt and peppers, where you come up, kind of alternating shoulder extension and flexion. Same thing, hold, 1, 2, 3, 4, 5. Get that contraction and that hold in there. You'll feel the burn with that guy for sure. 3 sets of 10, 3 sets of 15, work your way up, 3 sets of 30, right there. So you got that guy. You have the Ys, so you're making a Y with it, and you're not going straight up, you're making a little Y pattern. Same thing, 5-second hold, always 3 sets of 10, 3 sets of 15. You can make T's, nice and straight, working your arms there. You want to keep your arm nice and straight. You're not coming in here doing this. That's external rotation, which you don't want to do right now. You want to keep that nice and straight, like that. And then you're going to make your shoulder extension, where you come out a little angle. You might not be able to see that well from the video, but you're basically picking your arms here and you're going wide. You're not coming to your legs, you're going a little wider. 2, 3, and you want to take it back at a little angle. Hold for that 5 seconds. Really 3 to 5 seconds, but longer the hold the better. Work your way up, 3 sets of 30. So you got those. The next one we got is external rotation. And you want to have a towel in between your towel. You want to put it in between your arm. Very important. So you're keeping your heel in the stomach and boom out to the side like that. And some people want to go real far and strain. I don't like to do that. I keep it in a comfortable, pain-free zone. Always pain-free, always smiling. Just like that. Hold. 2, 3, 4, 5. 3 sets of 10, 3 sets of 15, 3 sets of 30. Now you would flip around to the other side, but I'll show you internal rotation with the band with this. And you start out here and you go in. See, it's a little light, so you can kind of turn it here, get a little more resistance, or get a little away and get a little more resistance that way. Remember, the darker the color, the heavier the resistance. So red's about medium, then green, then blue, then silver, then gold, then they have the ones like that. But if it was yellow, that'd be pretty light. You hold 1, 2, 3, and we're keeping our elbow by our side. Now what you don't want to happen is your elbow to come off your body and cause the towel to drop. So that's why I use the towel for the form in there, and you put the towel there. So you're keeping that good form, elbow tucked. Now we don't want the elbow to come forward. See how it's coming forward there? We want to keep it back and hold. People do that wrong all the time, so we gotta make sure we avoid those. And if you're a student or a therapist teaching, you gotta correct that good form, good ability on there too. Okay? So try those out with the Theraband. Just a little note, this is the red. So we got some green, there's a little darker, so a little heavier resistance. You got the blue, same thing, the blue Theraband. Thera tubing, whatever, and then the silver. You can see how thick the silver is. Get some good resistance on there too. So try those out. Like, share, subscribe, all that stuff. Thanks, guys.